Happy International Women's Day. This year's theme is Embrace Equity, and we have Dr. Nada Hamad joining us with a very brief interview. Dr. Hamad, could you please introduce yourself?
Hi, Rachel. Happy International Women's Day and Embrace Equity. My name is Associate Professor Nada Hamad. I'm a staff specialist hematologist, bone marrow transplant and cell therapies physician here in Australia, in Sydney. And I'm also president of Australia and New Zealand Transplant and Cell Therapies.
Fabulous. So this year's theme is Embrace Equity. The words equity and equality are often used interchangeably. So could you please explain what is the difference between these two words?
I think that's an excellent question, given that the theme of International Women's Day this year is Embrace Equity. Equality means each individual or group of people is given the same resources or opportunities. Equity, on the other hand, recognizes that each person has different circumstances and allocates the exact resources and opportunities needed to reach an equal outcome. And an example that some of the audience might relate to is, for example, if you're in the emergency department and a patient walks in clutching their chest, experiencing chest pain, and might have a heart attack, as opposed to someone who's tripped over and sprained their ankle, equality would mean that you would give them both a bandage for something. But equity is making sure you dedicate the correct resources for the need or the level of need the person's experiencing. And we know how to do this really well. So the patient is triaged. We understand that some patients need more resources and more support and more medical intervention to get out of the hospital alive and safe. So at the end of the day, you want both the person who sprained their ankle and the person who had the heart attack to come out of hospital alive and well. And so that applies to socioeconomic determinants of health and other metrics in our environment that help us understand that there's some people that need more support to get the same outcomes that we want for everyone.
That's a really good analogy. Thank you for that. And just continuing on, in the field of hematology, how would it be possible to apply equity to women's academic recognition and their career progression?
That's really important. So, what we're talking about here is representation. And why is it important to have women in the academic space, hematology or otherwise, represented? And that is because we are all, subject to our own perspectives, our own worldview, and our own lived experiences. And so it's very difficult for any one person to be able to step out of that and deliver a perspective for other people. So it's really important to have diverse representation. And it's not just about women. And that's why we're talking about Embrace Equity, because we want not only women, but diverse women with different lived experiences that can shape and can speak for and advocate for their perspective, their vision, their experiences. We need that to make the academic field innovative, diverse, interesting, and successful. So if all research is deeply rooted in bias, which we already know it is, how do we come out of that? And one of the ways we do that is by bringing all those different perspectives so that we can accelerate representation, accelerate innovation, and be able to apply the science and the knowledge to many different communities, many different people. And so the implementation of that data and the outcomes is representative and is relevant to people in our community. So that's why we need the women. So how do we make sure that women are getting to those places? Well, you have to think about equity again. Women in general have many barriers to getting to where they want to be in terms of their careers, both in clinical medicine and academia. And we have to recognize those barriers to be able to overcome them. And the only way to do that is to ask the women. Ask them what they need to get their work seen, their work sponsored and championed, and their voices heard. And generally, it means support that you would assume everybody gets, but really you don't. And so I often say it's really important that we accelerate the inclusion of women by being deliberate. So whenever you are in a position of receiving academic work, you need to be able to look for who the women are and elevate their voices. We need to lift up and raise up and amplify the voices of women and those who are diverse, because they don't have the same opportunities that others might. So I think it's possible, but we have to be deliberate about it and understand the importance of that diversity, how critical, how vital it is for the richness of the scientific and research community.
Fabulous, yes. And I guess as the president of Australia New Zealand Transplant and Cellular Therapies Society, how do you raise that awareness about equity within the society?
That's a good question, because I think sometimes people might say I'm on a soapbox, but I don't think I can say it enough. I call it out as often as I can. I speak about equity, diversity, and inclusion as much as I can, wherever I can, but I do it so with kindness. So all of my communications to the community, to the society, to the heads of the departments in Australia and New Zealand will have an element of please consider equity, diversity, and inclusion principles. It will have my pronouns and my acknowledgement of the land that I'm on here in Australia, which is Gadigal country, all in my email signature. But also in all of the academic work we do, I push very hard and I lead by example to say, it's really important that we listen to the voices that are not here. And how do we do that if they're not here? It's by being creative, being deliberate, recognizing and acknowledging that there are some people who are not in the room. And if they're not in the room, we can't just ignore it. We have to acknowledge that they're not here. And we need to be able to say that the data we're talking about, the information that we're talking about, the systems that we're developing and building, there is something missing. And even if we're not able to close the gap today, we need to consider it so we can close the gap in the future. And so I hope that in our society, I lead by example, which makes me sometimes a bit vulnerable and sometimes uncomfortable, but that's really important. And that's what leadership is and what allyship is. You really have to put yourself out there to make this a central issue, particularly in clinical leadership and in advocacy. And the second is to be persistent, consistent, and always make sure that you don't lose sight of the importance of equity, diversity, and inclusion in the groups that we grow together, the society we build together from the membership point of view, but also from the patient's perspective, because at the end of the day, we are here to serve a diverse community. And if we don't have the patients at the center of that and their diversity at the center of it, we will end up failing some people. And, you know, we're here to serve everybody as best we can.
That's great. And speaking of patients or populations, because during the Equality, Diversity and Inclusion session at the 49th annual meeting of the EBMT, you will tackle the problem of representation and ask if the design of stem cell transplantation trials discriminate non-white populations. Can you tell us a little bit more about this?
Well, if I tell you now, then why would you need to come?
Yes.
It's going to be happening in April. But you know what I'm going to do? I'm going to give you a little snippet. I'm going to say that, you know, the discrimination or the disparity in inclusion, the difference in inclusion of patients in transplant trials is the same as all research. All research tends to be more inclusive of white male populations than any other population or group. Because of the economy of clinical research, that's how it ends up being. And so does this apply in transplantation? The answer is yes. Like any other research, a field, it is the same in transplant as anywhere else. However, transplant is a little bit more unique because ethnicity actually makes a difference and gender makes a difference in a number of outcomes that is quite interesting. And we have a lot to learn about this. For example, access to transplantation is affected by your ethnicity. If you're white or Caucasian, your chances of finding a donor are much higher there if you're from a minority group or of mixed ethnicities. That means there is a disparity in outcome based on your own ethnicity that you have no control over and no one else has control over. And so how do we overcome that? And does clinical research in transplant actually take this into account? And the answer is not. We take a lot of things into account: conditioning regimen or intensity, male to female donor, CMV status, but not necessarily ethnicity and the access to transplant, because those patients don't actually make it to transplant. So we don't quite address the issue head on. And so there's scope for us to talk about this. And I'm looking forward to the discourse, the discussion that comes out of this, because I think it's not something that we've focused on in the past, but the world is moving really fast outside of medicine and even outside of hematology. And it's time for us to address these really interesting and exciting and controversial questions.
That is really exciting. So watch this space for the Equality, Diversity and Inclusion session coming up. And speaking of the EBMT, you're a member of the EBMT Equality, Diversity and Inclusion Committee. What actions has the committee taken to elevate equity, activate diversity and incorporate inclusivity at EBMT and in the broader BMT community? And what is the EBMT lacking?
Wow, that's a very big question. But first, I think the first step that EBMT has taken is to acknowledge that equity, diversity, and inclusion is very important. So we have a committee, we meet on a regular basis. We ask these really difficult questions of what does equality, diversity, and inclusion mean for the European community and the EBMT specifically? How do we address this for the local context? And Europe is very diverse, multiculturally, multilinguistically, and in terms of immigration, it's very, very heterogeneous and diverse. And so it's a brilliant opportunity to lead the world in, by example, in how to integrate these concepts in a society that is really international in its presence. So even the American Society is doing amazing work, but the European Society spans all of the countries in Europe, which is incredible. It's extraordinary. There are people from so many different countries committed and dedicated to this singular issue. And so beyond acknowledging this issue and creating a committee, they're starting to ask questions about what is the composition of the community, the BMT community in Europe and the membership, trying to ask questions about who feels included, who feels they're supported in their membership and in leadership. And so we've had a number of surveys that looked at gender equity and looked at the issues that members face in terms of whether they want to take on leadership roles or not and how they're supported in doing that, so that we can start to elevate the voices of those who need more support so that we do get a representative society. And there's been a recognition that there's a male dominance in leadership in the EBMT, and there's a commitment to change that. So we've even recently reviewed the bylaws just to look at the pronouns within our constitution and also within the documentation in the EBMT, and to review the leadership strategies and the leadership election strategies. So I think we're doing a lot of work internally, and what I'm hoping for is exactly what we're doing, which is slowly creating a focus on equity, diversity, and inclusion in the program and the annual scientific meeting. So last year we had a discussion about intersectionality in bone marrow transplant. And this year we're talking about its role in clinical research in BMT. And so I think the more we talk about this, the more likely we're going to get a momentum and an interest amongst the membership, so we can elevate these topics to more central plenary sessions. And perhaps that's where we're not quite there yet, so that these conversations are happening on a grander scale rather than for the interested few. So that's what I'm hoping to see in the future, is that the spotlight on this issue becomes much, much brighter and much more central in our discourse around the science that we do, the science that we deliver, and the care that we deliver.
Excellent. And with that, the EBMT's committee is named Equality, Diversity and Inclusion. We understand that it's important that we distinguish between equality and equity. Both are important, but they are different, as you explained before. So how do you think that the name should be changed to include equity too?
I have to say that my personal opinion is it needs to change to equity, because equality is something that we all, assume that equality means everyone is on equal footing. But the EBMT is having the journey that many of us face as individuals. You all as individuals, or we all as individuals, have to come to the understanding that not everybody has the same lived experience, opportunities, and privilege as us, because we are clearly educated, come from certain backgrounds that have allowed us to get to where we get to. And the patients we treat are not like that. And so in our minds, and as people who believe in fairness and justice and serving others, we all assume that equality is what we're striving for. But as the language and the science and the academic space in EDI, or in equity, diversity, inclusion, progress and advance and improve, we're starting to understand the importance of language. We are starting to understand the importance of moving in a journey arc, rather than assuming that there is an end game that we all will get to and we'll all be perfectly happy and everything will be equal and we'll be in a utopia, because that's not possible. So EBMT is going through the same journey many organizations have gone through and many people have gone through, to understand the difference between treating people the way you want to be treated versus treating people the way they need to be treated. And so allowing for that language difference to take form will be really helpful. So if somebody asked me, I would say, yes, I'd like it to change to equity. I would also like to add some of the newer acronyms that have been inserted into EDI, which include belonging and justice, because it's not enough to be inclusive. It's important to include others, but to make sure they feel like they belong and that they're safe to speak their mind and that they're safe to lead. And justice is really important because people who are from diverse backgrounds or minorities experience injustice on a regular basis on the form of microaggressions and macroaggressions that other people may not see. So it's important that we have a concept of justice in dealing with people's lives when we are responsible for their well-being in our communities, in our society, particularly the EBMT. And so one day we'll get to equity, diversity, inclusion, belonging, and justice, as many other societies have in other parts of the world. Thank you so much. And I hope everybody has a very happy International Women's Day. I hope you embrace equity. Equity is what makes the world richer, and it's what makes for amazing relationships. It's really important. And so it's not just about highlighting the role of women and the importance of women in our community and society, but also the diversity is extremely important. It's not just women. It's diverse women have to come along with us too, because their experience is very different, but also very valuable. So thank you for the opportunity, EBMT, and I hope to see you in April.